Hi there. Haven't had one of these in a while, but we still do them when we need them. It's Friday, the 12th of February. I'm J.R. Lewis, and this is a daily briefing. We're going to visit with Dr. Sanders. Thought it might be good to get caught up now that we've had another vaccine clinic. See if she has any idea when we might see some more of the vaccine. And also, there have been some changes in CDC recommendations, and we wanted to get her take on that as well. We keep this time slot open while pandemic response is going on. We haven't needed it much recently, as I said, but it's 1 p.m., 5 p.m., and 8 p.m. on the radio. And then we also use our YouTube channel, the Cordova TV channel, youtube.com/Cordova TV, to archive these. So you can always, at any point, check in and see what was the latest thing we visited with city officials about, and be able to do that on any device, of course, computer, smart TV, YouTube, works on all of it, phones and tablets and so on. So let's talk with the doc on the daily briefing here. So, Doctor, reveal unto us the status of the dashboard for starters. How's that look to you?
It's looking excellent. Right now we have one active case, and the active case numbers have stayed relatively low for the last couple of weeks. So we're happy to see that. The Cordova medical team is well practiced with our vaccine pods. When we're giving vaccination, it's going really well. It's very smooth. And it's actually something that I think we all enjoy because we get to spend a day outside vaccinating and visiting with the Cordovans as they come through.
So how did it go this last round then? Did it nothing, no concerns or hiccups, it doesn't even sound like?
No, we had a large vaccination clinic planned, and so we had help from Alanka with some of their nurses and staff come down and help. And it was a great day to be outside, a little bit of sun, a little bit of snow, and just happy to be getting people vaccinated.
Now, there was new information from the state a couple days ago, I guess, or maybe, it's always hard to tell in the midst of this thing, that they're opening up another tier, people 50 and older with certain medical conditions, and teachers and, school staff in general, and a number of these things. Cordova has actually been very proactive in this regard, in that you're just basically databasing everybody, right? How's that been going?
Well, yes, we are collecting. So we have a wait list for anybody that is willing to or wants to get the vaccine. They can sign up online on the hospital's website, or the link is shared on Cordova Prepared, or they can call the 424-3405 number and get on our wait list. We want everybody on the wait list, regardless of if they're currently eligible, because it helps us plan our vaccine clinics in the future and know how much vaccine we need to be requesting for each group. So that being said, the state opened up those vaccine tiers. We have used, in Cordova, we've already used up our allotment for the previously eligible tiers. We do not have any vaccine available yet for the opened up tiers. We do expect to be getting some more vaccine in early March, and we want everybody to sign up, particularly anybody that is eligible. And those eligibility groups are anybody above 65 years or older, any healthcare workers, anybody that lives in a congregate setting. And then the new groups are people above 50 years old with specific medical conditions or specific essential worker categories that have to work within 6 feet of people in the public, or any pre-K or child education staff. So if people are curious about their eligibility, they can go to the state's website and take the eligibility quiz, or read the documents that outline the specific medical conditions and or specific jobs. But regardless of eligibility, anybody that wants vaccine, we would like them to sign up on Cordova's vaccine list so that we can plan for them.
Does, the state puts out contact information for registering for vaccine as well. Is there any point in Cordovans doing that, or does it really make more sense to use the local sign up?
I would recommend anybody here to use the local sign up. We are not interfaced with the state sign up. And so we would ask that people use our local so that we can plan for them.
Okay, good. Anything else now as far as, if keeping the case count down obviously reflects well on what people are doing, do you feel pretty good about what you're seeing?
Yeah, I do. I think that people continue to do an excellent job here, and it's a great community to be a part of. I think one thing that we have been getting some questions about, the biggest question I get is that when will we have vaccine available? And we're trying, we've used up all the vaccine that we have. And as soon as we get more, we will get it into arms of people in Cordova as quickly as possible. The other question is the new CDC guidance for after vaccine quarantine.
Right. Yeah, I was going to ask you about that next. The CDC's done a couple of things or updated a few things, and the quarantine is one of them. So what's your interpretation of that?
So our interpretation is that anybody that is fully vaccinated, which means they've received their second dose and then given time for their immune system to respond, which is considered 2 weeks. So 2 weeks after your second dose of vaccine, you're considered fully vaccinated. The recommendation is you don't have to quarantine if you are close contacts for 3 months after after you're fully immunized. So there is that guidance is only if you're a close contact and you're not having symptoms. If you develop any symptoms after travel or after being a close contact, we would ask that those people still self-isolate and come and get tested. But if you're feeling healthy, you've been fully vaccinated, it's within 3 months of that period of time of being fully vaccinated, you do not have to quarantine after being a close contact or after travel, and you don't have to test after travel or being a close contact.
Okay, and then beyond the 3 months, barring any other developments, then it kind of goes back to the way it was prior?
There's a lot of speculation, and I think there's a good chance that guidance will be updated and that period of time will be extended. But for right now, everybody just needs to stay tuned and know that 3 months is the current guidance.
Okay. Well, and I mean, that's a lot of times the best we have to go on. You sort of answered my favorite final question already, which is, what do you hear the most? And it sounds like, in terms of questions, a frequently asked question, it sounds like people wondering about vaccine supply. We're hoping for some more in March, I heard you say. Anything else along that line, or do people just generally kind of seem to have an understanding?
I think people are doing well and do have an understanding. When guidance changes like this now, who has to quarantine, who doesn't, guidance, it can get a little bit confusing, particularly because there's always special cases. So there's certain congregate settings that are still going to have some quarantine. There's certain jobs that might still require it. So after travel or after being in close contact, certainly anybody can follow that CDC guidance, but still check in with your employer and make sure that you're following the employer's filed work plans as well. Yeah,
and that's a good point. That's one of it that you and I have had to talk about, the challenges of different layers of rules. I mean, the feds may say one thing, the states may say one thing, and then an employer's plan may be entirely different as well. So it's sort of, you kind of have to be aware of, any setting that you're going to walk into, that you have an understanding of the rules.
Yes, this has kept us on our toes for the past year.
Boy, I'll tell you. Fishing will be coming back up, so I'm sure you're not going to be relaxing. Well, thank you for the time and the visit. I'm glad things seem to be going, pretty well. Our case counts are low. Our vaccination clinics are working. That all sounds like real good news. And please pass along our thanks to everybody involved in making it successful.
Thank you.
All right, that's the latest from Dr. Sanders here, our daily briefing today for Friday, February the 12th. These come to you in the 1, 5, and 8 p.m. hours on the radio on a very as-needed basis these days. But again, we always hold the time slot open in case there's something to discuss. And you can always hear any of these on the YouTube channel, youtube.com/Cordova TV. So if you're ever worried that you missed one or you want to check and see that you've heard the latest one, that's really the best place to go. youtube.com/Cordova TV. Thanks for tuning in. We'll get back to regular programming now on the Clam and the Eagle.